So we have some new, interesting, and honestly kind of based executive actions from President Biden here. So this is in Politico. They say Biden reverses Trump-era limits on what's called short-term health plans. Democrats have long wanted Biden to go after, quote, junk insurance. So let me tell you a little bit about these plans, and then we'll go through this article here. But these short-term health plans are basically like if you're going from one job to another, or from one plan to another, and there's this interim period where you don't have health insurance, you can get this health insurance. And they've existed for a while. They were somewhat limited under Obama. Trump came in and he said, okay, I'm going to expand these things, and you could use them for, I believe, just over 3 years. You could use these short-term health insurance plans. Now, the issue with them is they're basically complete and utter scams. They take your money. Granted, it's lower. It's less than what an actual plan would be. They take your money, and you have basically no coverage. It's like just catastrophic insurance type coverage. But effectively, they're scams. And so now Biden steps in and goes, "No, we're going to severely limit these plans." He lowered the window by which you could have one of these plans. Okay, so here's what they say. President Joe Biden wants skimpy short-term health coverage to last no more than 4 months, reversing a Trump-era regulation. Health and Human Services, the Treasury Department, and the Department of Labor issued proposed rules on Friday that clamp down on short-term limited duration health plans, which offer cheap but sparse coverage that Democrats deride as junk insurance. The rule, which is meant to protect consumers and bolster the Obamacare exchange, would overturn a 2018 Trump-era regulation and satisfies liberal lawmakers and patient groups who have demanded the administration act since its first days in the White House. Quote, short-term plans are intended to provide temporary coverage as people transition from one source of coverage to another, said Neera Tanden, White House domestic policy advisor, on a call with reporters Thursday. Under the previous administration, however, companies were able to take advantage of loopholes and sell junk insurance for much longer than intended. The announcement, first reported by Politico, comes as Biden is set to give a speech Friday touting his healthcare agenda, which will include efforts to crack down on junk fees and other actions aimed at lowering healthcare costs. If finalized, short-term health plans will last for 3 months and can only be renewed for 1 more month. The Trump-era rule enabled these types of plans to last up to a year and be renewed for up to 3 years. So there you go. It's like 4 years total. A 2016 rule under the Obama presidency limited short-term plans to 3 months. Short-term plans do not have to meet the same requirements as health insurance plans sold on the Obamacare insurance exchanges. These requirements can include coverage of pre-existing conditions and certain essential health benefits such as prescription drugs. Okay, you lack some of the most basic protections with these junk plans. They're just a scam. Okay, consumers currently enrolled in short-term plans will be grandfathered in under the old rules, according to a senior administration official granted anonymity to discuss the details of the Biden plan. The rule does not limit the sale of short-term plans during Obamacare's open enrollment, as some Democrat lawmakers had hoped. When asked Thursday why it had taken several years to take this step, a senior administration official responded that we had been busy on healthcare. We have driven record high enrollment in ACA coverage. The administration also rolled out guidance intended to close a loophole in the No Surprises Act, which Congress passed in 2020 to keep patients from receiving surprise bills when they are treated by out-of-network providers. HHS officials are concerned that health insurers rely on certain loopholes, such as contracting with a hospital but claiming it isn't technically in the network, according to a White House fact sheet. So in other words, they're nickel and diming people and robbing people and price gouging people by giving coverage, and they say, oh, no, but you went to this person, they're not in network, so we're not going to cover that. And they're trying to stop that practice, saying it's fraudulent, saying you're not allowed to do that, No Surprise Payment Act, and they're trying to crack down on that, another very good thing. The guidance said that the move is not allowed under federal law. Healthcare services provided by these providers are either out of network and subject to the surprise billing protections, or they are in network. Administration officials are also concerned about consumers getting charged facility fees for work done outside of a hospital, such as in an affiliated doctor's office. A plan and hospital has to make consumers aware of these fees. So this is the equivalent of like junk fees for healthcare. They're nickel and diming you, and they're trying to stop the nickel and diming. They're cracking down on that. Several agencies also want to learn more about the impact of third-party medical credit cards. HHS, Treasury, and the Consumer Financial Protection Bureau want information on the use of such cards that feature extremely high interest rates, according to the senior administration officials on Thursday's call with reporters. The administration released new research on Friday outlining the impact of the Inflation Reduction Act's cap on Part D out-of-pocket spending. The report forecasts that the change could reduce out-of-pocket spending by nearly $400 for nearly 19 million Part D enrollees. So this is part of the Inflation Reduction Act. They're capping the amount of out-of-pocket costs for prescription drugs. Very, very good move. Again, I got criticisms. None of this stuff goes far enough, but it's so much better than any Republican by a mile and a half. Among this population, the report finds nearly 1.9 million enrollees are projected to save at least $1,000 in 2025. This comes at the same time that Biden did in the IRA an extra $64 billion for Obamacare to cover more people. So let's get the basics out of the way real quick. Biden ran on a public option. He didn't deliver on a public option. He didn't lift a finger for a public option. The real solution is Medicare for all, or at least one version or another of a universal healthcare system. But he said public option. He should have fought for it. He didn't fight for public option. So on that, it's a massive failure. But what he is doing is expanding Obamacare. Okay. And he is getting rid of these junk fees, but more importantly, these absolute scam health insurance plans, which are just a scam. It's so people can say, oh, I have health insurance, but really all that's covered is the catastrophic stuff. Nothing else is covered. And it ends up nickel and diming everybody in sight. So this is definitely a good move. This is definitely a step in the right direction. But now, the real fight should be over. We got to get rid of these rapacious, unnecessary, mafia-like for-profit insurance companies that are just there to shake you down and make a profit for providing no value at all in any way, shape, or form. And so that's the real fight that we have to take on. But at least what's happening under a Democratic administration is they are reining in the excesses and the abuses of these rapacious companies that shouldn't exist. Whereas under the Republicans, they let them run wild and free and rob everybody blind. And so definitely a step in the right direction. And again, I think he has the authority under the IRA for certain parts of what he's doing here. But more importantly, some of it he's just doing through executive action on his own and reversing a lot of the Trump era stuff. Definitely a step in the right direction. These plans are total junk insurance. They need to go away. No doubt about it. Hey, y'all, do me a favor and like and subscribe. It helps out big time in the algorithm. Click the bell as well for notifications when videos drop. And watch that video on screen right now. You know you want to.